Well, good afternoon, College of Eastern Idaho, and then any of our guests that we have on Zoom or I'm sorry, on Facebook or YouTube. It is wonderful to have you. We took a week off last week, but it's a pleasure to be back, and it's a pleasure to introduce Jodene Trimble to you. And for a lot of you, that isn't an introduction at all. You've known her for a long, long time, and nursing is such an important component of the college, and it's grown so significantly. It's going to be a real pleasure to introduce Jodene and kind of go through a variety of topics within nursing. So Jodene, welcome today. Thanks for taking some time.
Yeah, thanks for having me. I guess I don't know whether to say thank you or not, but thanks for having me today.
I shamed you into this. I know you've got a lot going on with the nursing accreditation, and we'll cover that in a bit because it is important and you are buried with it. But a wonderful way to start is let's set some context with you. So talk a little bit about your background and why are you in a community college?
Okay, so I've been a nurse for almost 19 years. I started out at Eastern Idaho Regional Medical Center. While I was going through the nursing program, I actually worked as a nurse apprentice and then hired on and started working in the pediatric unit. So my background is pediatric, and then I switched over to NICU partway through that. So I had about half of my live, experience, hands-on experience, pediatrics, and then half about NICU at ERMAC. And about 8 years ago, I guess it'll be 8 years in August, I was given the opportunity to come over to CEI, which was ITech before, and to start teaching over here. I started with our fundamentals class and leadership class and transitioned into maternal child nursing, which is kind of my passion because that's where my background is. And I guess probably about 4.5 or 5 years ago, had the opportunity to take on the role as the simulation coordinator here at CEI. Again, I think at that point in time, we were still iTech and kind of in that transition phase.
Right.
And from there, about 2 years ago, was given the opportunity to work directly with Kathleen Nelson, who is amazing. In lieu of her retirement, they were recognizing that she was going to be retired before long. And I had kind of this unique opportunity to be mentored by, I think, one of the greatest leaders out there over the last couple years. And then she retired in December and transitioned into this role as the nursing administrator and chair here at CEI.
So Jodene, it is so good to have you in that position, and the shout out to Kathleen is well deserved. I can't even, I should know how many years she has been at this, but a long time, and she's been recognized regionally and in many different venues. So you learned from the best.
Yeah, I definitely have big shoes to fill, and it makes me nervous every day that I've got to live up to her legacy and everything that she's put into the college here, because a lot of the things that we have going on in the nursing program are because of her ingenuity and hard work and dedication. So,
well, you've got your own skill set. That's the reason you're sitting in a chair.
Yeah.
So.
Yeah, well, thank you.
And we're so appreciative that you've agreed to take on that leadership role. And this is a critical time, but I guess maybe before we get into what accreditation is all about, and you brought up iTech, why don't you just spend a minute and maybe contrast nursing at iTech, maybe let's say 5 years ago, and nursing today at CEI. What do you see as differences in those two?
Yeah, I think probably our biggest difference is how many students that we get through the program now. When I first started on, even probably before that 5-year mark, it seems like we were only admitting once a year to each of our programs, and we were only admitting maybe 15 to 20 students a year. So right now we admit, I think, close to about 120 students a year, and we're graduating, close to that throughout that year. So that's pretty awesome, and that was a big transition. And we've implemented a couple new programs. So one of the things that we were hearing from our community partners was that we needed a PN to RN bridge program, and we needed a part-time program that could accommodate some of our students that have to work through the program. And so that's allowed us to increase those numbers. So that was a big trend, or that was a big change. Another big change had to do with our simulation center and the opportunity that we have to administer these simulations, thanks to an amazing gift from the Bill and Shirley Make Foundation. I happened to be the sim coordinator at the time that Kathleen had come to me and said, hey, we've heard that there's a foundation, we didn't even know what foundation, that wants to give a gift to the college. And they're asking for us to dream big. And so she says, I'd like you to put something in for this simulation lab. And I think I had like 24 hours or something crazy like that, come up with a proposal and with a list of supplies and needs. And luckily, I'd been looking at other sim labs, and somebody had told me at one of the conferences that I'd attended, they said, you know, if you do great things with Sims, somebody's going to want to fund you. Somebody's going to want to help you guys grow this program. So I kind of had a list in the back of my mind. And thanks to the Bill and Shirley Make Foundation, they awarded us everything that we had on our wish list and even more. And so it's provided our students with this opportunity where they can go into simulation and they can practice kind of in a safe setting before they go into those clinical settings. It became especially important as COVID's hit and we've lost some of our clinical slots just because we have so many schools competing for those slots. I shouldn't say that we've lost them. They've just been absorbed, you know, right now as everybody's trying to get through this crisis. And this simulation center really has made the difference for our students to be able to get those clinical hours and meet the needs that they have to go into practice. So I think those are some of the big things. The other big thing, I guess, that I see is our faculty has grown like huge. When I first started, I think there were maybe 6 of us. And now between our faculty, our admin assistant, between our sim tech, I think there's like 17 that we have on staff. So, you know, we've grown a lot. We're producing a lot of nurses. We've seen a lot of changes in the programs that make it more reachable to maybe students that it was out of reach for. So those are some of the big things that I've seen.
You know, that's a great synopsis. And at any college, we are a people, kind of a people organization. And, you know, we're so proud of the nurses because they are some of the best. I get compliments all the time when I'm out in the community and run into someone and they know anything about our nursing program. So this all really falls at the feet of the faculty who are teaching. And you've got a wide variety of skills in our nursing faculty. So you've done a great job of hiring, all of you that are in the process of hiring. So I think that's kind of the key. Tick off a couple of areas of expertise that our viewers might be interested in with your faculty.
Yeah, so we actually have several faculty members that are still working in practice. So I think that's really, really helpful for our students. So we have faculty members that work in the emergency room. We have faculty members that work for home health agencies. We have faculty members that have been on the Life Flight team.
Right.
We have faculty members with OB and pediatric backgrounds. We have faculty members that have backgrounds in mental health. So we try to match up our faculty members with their area of expertise. And we have been really, really lucky to be able to do so and have such amazing faculty here at CEI. I've never worked with a more remarkable team than I have here at CEI.
That's exactly right. So a student who leaves us gets a broad exposure to nursing as a career because of the faculty that we've got. You know, you brought up simulations, and from a macro level at the college, I love the idea of simulations. And for the other departments that are listening to this, you had a wonderful gift and have used it significantly. I think, you know, in my past life, I was a pilot, and within that realm, simulations are just so critical for some of the things you've described. you shouldn't be flying around on two engines just to see if it works, but you certainly can do that in a simulator. So yeah, you get an opportunity to put students under a lot of stress before they go out into the clinical settings. I love that, and I think we need to be an institution that deeply embraces the idea of simulations.
Yeah, the simulation piece has been super beneficial for our students. When I first started here, they said, we need you to start simulations. That we had a few simulations that were going on, but none for the OB. And so it went from us putting a ball in our male mannequin's abdomen to where we now have these mannequins that actually do these. And we can put them into those situations that I can't guarantee in clinical they're going to see these critical situations, but I can in simulation, and I can give them the prep work beforehand that hopefully we set them up for success. And then if they've made mistakes, that debriefing piece is so critical, that they get a good debriefing where we can talk about those situations, and then they can really learn from them and improve when they go to practice, when they have that hands-on experience with that patient.
I love that concept of debrief. And again, just back to my flying career, you wouldn't fly a mission and come back and not debrief it. So spend just a minute and talk about after a simulation exercise you do with students, how do you debrief them? And I think you've got video in there, which is quite telling. So how does that work?
Yeah, so I guess to understand how this process goes is, the students are doing simulation. Like you said, we have multiple camera views that we can get. So we can zoom in close enough that we can see them doing their math calculations. We can zoom in, we can see the oxygen level on the wall. So that's really nice. Yeah. And we have typically some students that are in the other room that are watching this simulation, and then they'll either go in and participate in a different simulation or continue on with the same simulation. And so in this process, those students that are in the room, they have some tasks to write down some things that they see went well, maybe some things that needed to be improved on, right thinking, wrong action type things. Yeah. And so then when we pull all of our students back together to do this debriefing as instructors, we've been able to view it from another room, and these students have been able to view it from another room. And we talk about that. We use what they call the Tanner debriefing model, Tanner judgment. And so we start out by asking them how they felt, because we've got to get that piece out there before we can really talk about the situation. And then through this process of debriefing is not where me or the other faculty sit and lecture them on the situation. What we want is for them to make those recognitions. So it's basically a leading session where we lead them and we guide them through that thinking process so that they can recognize where some of those things need to take place. Now, sometimes maybe they don't recognize it and we have to talk about it, but we try really hard to guide them through that process. And one of the things that I think is really important is they'll go through and they'll talk about how they responded and maybe what they should have done. And then after this conversation, then we reflect past that. And even after this conversation, now do we realize that some of these things still are different, or have we made connections that maybe we hadn't made before? I think there was one time we were sitting in simulation, and I have to talk about OB stuff, OB and peds, because that's my background. And we had these students that were going through, and it was a delivery of this baby. And they'd done all of the pre-simulation paperwork where they'd had the questions, they'd had the answers, they've looked at all this stuff, but for some reason still hadn't made some of these connections. And so we're in this debriefing and they're talking about, well, was there anything else that would have given us an idea besides the mom saying the baby's coming, that this was happening? And all of a sudden the light bulb went on and these students were able to teach each other and say, oh my gosh, we looked at the monitor, we saw that we were having these early decelerations that told us this, and that told us this piece, but we didn't recognize it. We saw it, but we didn't put the pieces together. And from then on, they understood the importance of fetal strips. And so I think, that simulation piece in that debriefing, the simulation itself is critical, but that debriefing piece to guide these students, and our faculty are amazing at doing this, to guide them and lead them to make these connections on their own, because then that's when it sticks with them. If I tell them, it doesn't stick with them, but if they make those connections, it sticks with them.
You know, it really does. So they know going in what best practice would be, and in the heat of the event, and quite frankly, I'm sure that when they get in it, they forget that it's a simulation and it gets stressful. So being able to then back out and do an immediate debrief on what went well and what went wrong, you know, it's kind of the combination of the things, and especially having them look at that, at what happened, and then be able to reflect on that is such a great, what a great active method for teaching and learning. I am just so impressed with that. We need to do that in a lot of other disciplines as well.
Yeah, simulation has been great, and it's been great for our students. They're loving simulation. They're loving the experiences they have. And huge shout out to like Reagan, who's the sim coordinator, and her and Casey have been working on trying to get all of our faculty on the same page with doing some evaluations and different things like that. So we have an amazing team.
So it's just literally cutting edge. When we first got those simulators, I think BYUI has got a pretty good set, and obviously the universities do, but I think as we look around, they had a simulator envy, I think, for what we got a couple of years ago, because it's a wonderful both a set of classrooms and the simulators themselves. So we are coming up on a nursing accreditation visit. So that's different than our Northwest accreditation. So why don't you start by telling us what's unique about a nursing simulation, and why is that different than Northwest?
A nursing accreditation, yeah.
Accreditation, I'm sorry.
So I guess one of the big things, there are some similarities, right? The reason why we get accreditation is to kind of validate that, and I guess hold us accountable for the things that we say that we're doing, making sure that we're having appropriate rigor and evidence-based practice and different things like that. So in some ways, it kind of mirrors what we're doing on the college level. But for nursing specifically, I think we are one of the only ones, the only colleges in the state of Idaho that is not nationally accredited. And it ends up causing some issues for some of our students that would like to go on. And a lot of our students choose to go on. I love that we instill that love for learning in them and they choose to go on. If our students do not graduate from an accredited nursing program, so even though the school is accredited, but if they don't graduate from an accredited nursing program, it can put some challenges in the way for those advanced degrees, especially if they're wanting to go on for their nurse practitioner or their CRNA, which we have a lot of students that would like to do. So this kind of levels that playing field for them as well. There are also sometimes state regulations that make it hard for them to work at certain places. So we've learned that without our students graduating from an accredited program, they can't work at like the VA hospital or certain things like that. So by allowing our students, or by creating this opportunity for them to graduate from an accredited program, it really opens every door to them. As you said, you know, we have good relationships with our community partners, our clinical partners. They love our students. They want to hire them, you know, so that piece is already good. But we do have a couple boundaries that they have to be able to jump over and get through if they want to continue on with some of those other goals.
So that makes perfect sense. And was it a week ago, not this week, but the week prior, several of us in the leadership team, and I know student services, got an opportunity to sit down with a mock accreditation visit. You had a delightful accreditation director that asked us some questions. So how does that mock visit work, and how different do you think it's going to be? And by the way, when is the accreditation, and how do you think the actual accreditation is going to go?
Yeah, so our actual accreditation is March 1st through 4th.
Yep.
So it is like 3 weeks away. And it is going to be it will be different than our mock visit. But I think the nice thing with that mock visit is it gave us an idea of what to expect. Our nursing program has never been accredited before, so this is new for all of us. The way that came about is we are partners with ATI. They are a company that that we have partnered with to make sure that our students have the tools that they need and our faculty have the tools that they need to help our students to be successful. And they offered this opportunity as one of the consulting days, if we chose that, that we could do this mock ATI or mock accreditation visit. So when we set it was set up just for one day. And like I said, our accreditation is actually 4 days. So there's going to be more that will go into it. But she met with you and Lori, and Clint was in the administration one. She said that you guys did a wonderful job. A lot of things that they look for is they want to make sure that the nursing program has the support from administration that they need to do the things that they need to. They have the funding, the abilities to do that. And she said that you guys set us up really nicely. So she was pleased with that interview. She said the one that she just raved about. So shout out to our student services, because she just went on and on and on about how amazing our student services are, that she could tell that there was a love for our students from our student services, and that related to our faculty interviews that then we had. So those were the 3 big meetings that we had. She met with administration, she met with student services, and then did a big faculty meeting. And then she met with me and Kathleen, and then at the end, Clint, our dean, as well at the end to kind of give us a debrief. She has a report she's putting together, but I haven't received it yet. So once I get that report, I'll pass that information along to you. With our site visit, other things that are going to be included in that will be, they will have a meeting with our clinical partners. So we're working on some details with that to try to get all of that set up. So our clinical partners, I think they're hoping to meet with the ones that our students mostly go to clinical at. So Madison Memorial Hospital, Mountain View Hospital, Idaho Falls Community Hospital, ERMAC. They might meet with Portneuf or Bingham as well, because we have students in all of those areas. And then they'll do a meeting with our students. So we have to have a meeting that's available for any of our students that would like to attend, current students in the RN program that can attend. Because this accreditation is only happening for our RN program, not our LPN program. And then I'm trying to think, and then they'll have a community meeting. So if there's anybody in the community that wants to come to that meeting, as soon as we get some times finalized, we'll send that out. Where people can talk about the program, things that they like, concerns that they have, things like that. So it will be a lot more in depth because it's over 4 days versus the 1 day. But when we debriefed with Anne from ATI, she told us that she felt like we were doing really well. There are lots of things that we can always improve on. Sure. But we have a good program. She said that we have a robust program. She could tell it was well established and we had good support. So, we plan on passing that. We're super nervous, but somebody once told me, if you're not nervous, it shows that you don't love it. So it's good that we're a little bit nervous, but we also know that we've got a great program and we're super excited to see that come to play for our students. The other piece that's interesting with that accreditation is that we are under candidacy right now, and we've been under candidacy since 2019. So any of our students when we get this accreditation, right? When we get this accreditation, any of our students that graduated while we were under candidacy, so from that I think it was fall of 2019 that came to be, they can all say they graduated from an accredited program. So it actually backdates for part of that as well.
So what a wonderful recognition, and it's important. So having the industry recognize the great work that you do is so important. What is an NCLEX, and how does that play into our students?
Yeah, our NCLEX is their national licensure exam that they have to take. So it's not enough that they graduate our program and they get through the rigors of the program. They have to take a national exam, and they have to pass that exam in order to practice. And so, we set our stuff up our classes, our courses, our simulations. We set everything up to make sure that we're meeting the standards for our courses individually, but as well trying to make sure that we're meeting these standards for this NCLEX, this national exam that they're going to have to take at the end for their licensure.
So what's our pass rate here for NCLEX?
So our pass rate, I think over the last 3 years, 90s, in the 90s, like
Good.
low mid 90%. I think maybe a year ago we maybe dropped down to 89.5%. But nationally, I wish I should have looked the statistic up, but we have really high pass rates. Just a week ago, 2 weeks ago, we had the state board for nursing. They came and did our visit, and she was super impressed with our pass rates and impressed with our students and impressed with the program. And as long as the board approves it in their next meeting, they've given us a pass for 8 years, which, we don't always get that. So again, was one of those testaments to our program and the great things that our amazing faculty do here day in and day out.
So now you mentioned this, a student would get an associate's degree from us. When they pass NCLEX, they're able to get a job. But really, I think you would probably, I think I've got this right, that a BSN, a baccalaureate, is an important element professionally. So what options are available to our students once they've gone through past the NCLEX and feel like a baccalaureate is important to their career? How does that work for our students if they want to use it?
Yeah, so that's a great question. And I'm actually, I don't know if you know this or not, but we have several articulation agreements with institutions, okay,
yep,
where they can actually, with some of these institutions, start on their bachelor's work after their first semester in nursing school. So we have it set up for, if our students choose to, through some of these institutions, they can actually graduate with their bachelor's degree 1 semester after they finish their associate's degree, which is pretty awesome that they can do 2 at once. Now, not all of our students do that because a lot of them work, they've got other responsibilities, but they have the opportunity to do that. What the bachelor's degree in our area, a bachelor's degree isn't required for entry into practice, but if they want to be, often most of the institutions or most of the facilities, if they want to be a charge nurse or go into management, leadership, anything like that, they'd require them to have a bachelor's degree. They also strongly encourage it. And I think I saw a statistic, and I don't know if I'm exactly right with the statistic, but they said our nurses in Idaho, I think, have like about an 80 or 85% of them have bachelor's degrees. And so there is kind of that big push for those bachelor's degrees. And it's pretty awesome that we have some partnerships in the community that can help these students attain it early, like within a semester after they graduate, or they can start these programs after they've graduated or any time, after that. Most of them allow them to take those classes kind of at their own pace. So if they feel like they can take more classes, they can. There are certain classes they have to wait till after they graduate to take, but they do have the capability of achieving that within about a semester after graduation if they choose to.
I can't think of an example outside of what you just described for one of our students to be able to finish a baccalaureate that quickly. That is amazing. So those relationships are so critical, and what a great opportunity for those students. And I can see why 80 or 85% want to get that bachelor's done. Even if you don't want to be in supervision, you've got it there if you change your mind.
Yeah, well, and I think the one thing you find with nurses in general is they're lifelong learners. Everything is constantly changing in nursing. That's the thing we tell our students all the time. This was like a famous Kathleen line that she'd tell the students. The only thing constant in healthcare is change, which is true. About every 5 years, you expect to relearn everything. So I don't, it doesn't seem like a surprise to me that so many of these students do continue on for continuation of education because we have a passion for making sure that we're up to date and current and doing best practice for our patients.
Sure. So how many, it's wonderful that there are 2 entry points RN during the year, which is really important. How many slots are there, and how many candidates are there for those slots? And then for the ones that are accepted, what does it take to be accepted?
Yeah, so we do for our full-time program, we accept twice a year for the RN program. And each of those, so for our spring and for our fall, we have 30 slots for our full-time program. For our part-time program, RN program, we accept once a year. And for those students, we have 16 right now. We were really hoping to go up to 20, but with COVID and clinical placement, we haven't quite been able to get there yet. So we're hoping in the future that we're able to do that. With the bridge program, we have again 15 or 16 slots that we accept once a year, again hoping to go up to 20. And then our PNs, we accept anywhere from 15 to 20 depending on our qualified applicants per semester. So with that, there's about 120 or so open slots for nursing over the year. I'm trying to think. Our last application process, I think we had almost between 90 and 100 candidates, and that was for two programs. That was for our part-time and our full-time. So we accepted 46 of those candidates. So that still leaves some space for some of those other ones. And the semester before, I think we had somewhere between 60 and 70 applicants for 30 slots for our RN program. Our PNs, we don't have as many applicants for that because it seems like a lot of them want to go on to the RN. There is a need in the community for PNs. And now that we started our PN to RN bridge, I'm anticipating those numbers kind of increasing a little bit for our PN applicants.
So what is the criteria that you use in nursing to select a candidate and offer them a seat in nursing?
Yeah, so it is a very competitive process, and we do have a process that's in place. We don't talk about everything that we do in this process, but we do let students know. We look at their grades. We look at their grade point average. For our RN program, they have to have above a C at least in all of their general classes. And many of our students have higher than C's, that they're coming in with. They also have to take a placement test. It's called a TEAS test. And there's a certain score that they have to achieve on that. And again, the higher the score, the higher the likelihood that presents that they're capable and ready to come into the program. We have a interview process. It's a video interview that we look at as part of that process as well. And we have reference letters that are submitted. 20 or 80% of our candidates are selected based off of this rubric that we use, that we go through. And then we reserve 20% of those slots for us to kind of look at outside of that. And so oftentimes we have our community partners, which our community partners are amazing. We couldn't do what we do without our community and our clinical partners, those clinical partnerships. And so sometimes we have students that are prospective students, hopeful students that are working in those institutions or working at those places. So like at Ermac or Madison, Mountain View, Idaho Falls Community, Bingham, Portneuf. And sometimes those clinical partners will reach out to us and say, hey, we really, really want this person, to be a nurse. And so we have the ability to kind of look at some of those things as well. It's not a guarantee that we can get them in. They have to meet the standards. They have to meet the requirements. We only have a selected number of slots, but it's kind of our little way, our little bit of giving back thanks to our clinical partners that, without those amazing clinical partners, we couldn't do what we do.
And a clinical partner is different maybe than mom or dad or something like that. So they would not recommend a student who they didn't want to have on staff. So I'm really glad we kind of have a dual track and have some level of ability to let that kind of a student in to support our clinical partners.
Yeah, it's been good. We've had really good success with that. So it's been nice. And oftentimes, they get in on their own, but it's just that extra it's that extra, I don't know, that extra piece that you just, you know what they're doing in practice, and they're going above and beyond, and it helps us to make sure that we maintain those connections, because without those connections, like I said, we couldn't do what we do. If we can't get those students good clinical opportunities, they're not going to be successful nurses. So we have to do everything we can to keep those I don't know, those gates open, those
Right.
doors open.
How does a preceptorship work?
Okay, yeah, I'm glad you asked about that. So a preceptorship is where our students will be set up with a specific nurse, and they'll work the same shifts as that nurse. Up until this semester, our program was set up a little bit differently, and they'd have a preceptorship, but they only had to do like 5 or 6 shifts over the whole semester with this one nurse. We just changed our program, and our first cohort is in their internship right now with precepted nurses. And I guess it's important to understand that we changed our program based on what our clinical partners were telling us. They were telling us that nurses in general needed a little bit more preparation for that education to practice gap. So making sure that they had the critical thinking pieces, the time management pieces, those different things like that. And so as we listened to that, we put together this model, and Kathleen was kind of the groundbreaker with this that got everybody excited about it. But this model puts them in clinical for 15 weeks, working full-time shifts with this preceptor. Yep. So they're actually working days, nights, weekends, holidays, whatever that preceptor is doing. So they do 3 different rotations. So they work alongside of 3 different nurses, typically in 3 different areas. We have a couple that are in the same area the entire time, because again, our clinical partner said, we want to hire them in this area. They've been working for us. We want them to stay in this area. So they rotate them through their preceptors there. And we are hearing, our students were a little bit nervous coming into it, and we were a little bit nervous because our students were nervous, and we're hearing really, really good feedback. They are in their 4th week of this rotation. And the students, I've just talked to probably about 10 students in the last couple days, and they are loving it. One of the students was telling me that he actually worked 3 shifts, or did 3 precepted shifts in a row, had 1 day that he worked at the hospital, and then did 3 more precepted shifts. He hadn't had a day off for 7 days. And I was like, oh, are you guys surviving? Are we killing you? And he said that he wouldn't change it, that he's actually loving it. And that's what I keep hearing. The other piece that we're hearing from our clinical partners is that they are loving it. We've actually had them request to keep some of the students longer. They're like, we don't want to give them up after 5 weeks. Wow. We want to keep them with us. And some of them are even, being put on the list for, we want to hire the student for this job. And so I think it will be interesting. I can't wait to see the statistics. I want to see what it does for NCLEX pass rates. I want to see what it does for our community or our clinical partners. How are they feeling about this? Do they feel like the students are coming to them more prepared? But from what we're hearing right now, just the first 4 weeks into this, I think we're going to have good statistics that come back from that, and good results, the results that we were hoping for.
I'm glad we're keeping that data. That's really important. You saw Trustee Scheid. I think you might have seen she popped up, and a great shout out to nursing. So how with the other community colleges, how many of them use a preceptorship model in their practice?
So none of them use the preceptorship model that we're using in our area. Most of them are doing like what we were doing, 5 or 6 preceptored clinicals. There might be one school that has like up to 10 or something precepted clinicals. It was pretty groundbreaking for this area here. You may see some of it back east. You may see some of these preceptor type models, internship type models in some other areas in the country, but not here. And it caused some stress for our clinical partners a little bit, because it is so different, and they're trying to work with so many different schools to get them in. But I think because of the positive results and the positive things that we're hearing from it, I wouldn't be surprised if we see some other schools that end up trying to follow this model.
I think that's wonderful. So kind of keeping with our tradition of being innovative and nimble and young. So I when I first heard of this, I was so impressed. It seems like the right way to do this. One of the topics, talk for a second about pinning. What is nurse pinning, and why is that such a big deal?
Yeah, our students have been so sad. Like we haven't been able to have our pinning, and they've been devastated. But nurse pinning dates back to, like, I don't know, a long time ago. And it's kind of a rite of passage for our nursing students to be able to receive this pin. And for our nursing students, the pinning is almost more important than their graduation ceremony. So for some of our students, when we had COVID that hit, we were able to, I think in the spring, we were able to do it at the drive-in theater. It was a little unorthodox. They were a little bit nervous. I think by the end, they were super excited and happy that it played out like it did. But for the winter, we didn't have that option. And so those students, I mean, they were just devastated about it, because it's kind of that rite of passage. It's that important milestone for them to receive this pin. And oftentimes we allow them to pick one person to pin them. So somebody who's important to them or helped them through or was a role model or whatnot. And so for them to not get that, was pretty devastating. And so I'm excited that it sounds like we're going to be able to have some sort of nursing pinning for the spring for these students, because I've already had students reaching out about it. That pinning ceremony is super, super important for them.
It is. I think we're going to be able to do that. So that is so important. And Linda and I have made most of those pinnings, and it's always a big treat for us to be in that, because there is so much excitement, and it is a professional rite of passage and a wonderful milestone for them. So I'm glad that we're able to do that.
Me too, and they will be too.
Or they will. They absolutely will. So Jodene, one of the things I like to end with is to have a guest reflect on a couple of leadership principles that they've used. So do you have any sage advice for us?
Well, I already told you, I was going to tell you in my 1 month in this position, but President Aman told me I couldn't get away with that.
I don't buy that. No.
But I think some big things for me, I think communication is huge. Communication is a huge piece, that listening piece, that communication. Teamwork and collaboration is huge. Reaching out and having some of those partnerships and networking opportunities, because the reality is everybody's trying to do the best thing they can for students, as we're in education and as we're in nursing education. And I think, having that collaboration, that networking, being able to reach out to people, whether it is within nursing in general, or whether it is outside of that to student services, to administration, those pieces are so huge, and help with this whole process. When COVID hit, we had to come up with a policy to put in place so our students could still practice in the lab and we could continue our program. And the only reason why we ended up with the policy we did is because we had some connections with other institutions. Yep. And so we reached out to Boise State, who had put a policy together, and they let us take their policy and update it and use it to what we needed for ours. And so I guess as we come together and we realize the importance of working together, I think that's been super important in leadership.
Those are wonderful attributes, and they serve us well as leaders. And again, I'm so appreciative that you've taken the chair, and we're going to see some great things. So Jodene, thank you for being my guest this week. It is delightful to have you. And I think especially for new viewers, it gives them an understanding of how great a student that we're turning out here at the college.
Yeah, we have amazing students. We couldn't do it without the college as a whole, the support from the college as a whole, all the way through, or without our community partners or our clinical partners. So
So have a great weekend. So thank you again for joining me. And for our guests that are viewing, I'll give you a preview that next week Brent Stacy is going to be joining me. And some of you know who Brent is, and maybe you don't. Brent is retired from the lab, but has been deeply involved in Idaho Regional Optical Network. So essentially the fiber that moves across all of Idaho, connecting hospitals, the colleges and universities, and most importantly connects with the lab. And he's been deeply involved in cyber as well. So we'll have a equally interesting discussion with Brent next week. So I wish you all a great weekend, and just looking forward to a discussion next Friday.